Hello everyone, my name is Sisto, and for my senior project I worked on translation services for non-native English speakers in the Medicaid community. My essential statement is facilitating a connection between college foreign language departments and non-native English speakers at risk of losing their health insurance. So I chose this project because I participated in an internship last summer at the Neighborhood Health Plan of Rhode Island, which is a nonprofit healthcare management organization that primarily caters to Medicaid clients who are individuals who are low income and qualify for government-funded healthcare. I also chose this topic because it's within the public health realm, and I plan on pursuing a career in the medical field, so I thought this would provide some context about what some of my patients could possibly be dealing with, and also it would be helpful to a lot of people. So for some background, at my internship, I was tasked with contacting Medicaid members who were at risk of losing their health insurance due to something called the redetermination process. So redetermination is something that typically happens annually, and it's where Medicaid members are assessed for their eligibility. However, during the pandemic, it was declared a public health emergency, and something called continuous enrollment was allowed, which essentially allowed Medicaid members to retain their health care coverage without being assessed for the eligibility, which made sense at the time. However, once the public health emergency ended, each state was required to undergo the unwinding process, which essentially reintroduced the recertification for their coverage. So why was this a challenge? So according to Sarah Broom, who is a Medicaid health services consultant, many low-income families are more likely to move around more often, meaning they have impermanent addresses. And additionally, many Medicaid members are likely to have frequently changing phone numbers, and all of these factors make them very difficult to contact. And this is just on a normal year. But after 3 years of a public health emergency, contact information was 3 years out of date. And in addition to this, many Medicaid members had joined during the pandemic, so they had no idea what the recertification process was at all. So all of these factors kind of created the perfect storm. So as I worked as an intern, I kept a journal of my observations, and one of the most recurring patterns was the lack of resources for the non-native English speakers within this community. And after reviewing my observations with Ms. Copese and Mrs. Cheney, I kind of reflected on the resources that were around me. I was also in the process of touring colleges at the time, and I couldn't help but notice the amount of very well-developed foreign language departments around us in the New England area, and the amount of students who were in need of real-world experience within their subjects. So not only were these needs observational, but they're also statistical, because 75% of all terms are procedural, and that basically means that 75% of people who lose or who lost their health care during this redetermination process lost it due to reasons completely unrelated to their eligibility to be enrolled in Medicaid. So either meaning they didn't receive any information about it or they didn't know how to fill out their paperwork. And additionally, 19% of neighborhood health plan members are English speaking as a second language. So there is a large portion of people who are in need of these services. My mentor is David Burnett. He is my uncle, but he also works at Neighborhood Health Plan as the Chief Growth Officer. So he has pretty extensive knowledge on the Medicaid community, and he was also able to provide me with a lot of data and information that I needed. So the preparation phase of my project was finding a recipient for my services. So I initially explored working with Neighborhood Health Plan, but I ran into too many regulations and possibilities of HIPAA violations, so I changed my approach and I researched more local community health centers. After reaching out to about 8 of them and not receiving a response, I decided to contact the Millis public health nurse, and she was able to give me the contact information of a community health worker. And after being in correspondence with her for about 2 months, we confirmed that she was in need of my services and that we would work together and I would find volunteers. So next, how I found the volunteers. I researched the top language programs and the professors who led those programs, and I compiled a list. I then drafted a letter template, which you can see on the right here, and I sent those letters about 12 at a time, a week apart to the colleges. And I actually did receive responses from several schools. The first was Tufts University. I also had Colby College and University of Connecticut. And so now that I had my list of volunteers, I went back to the community health worker and told her that I was ready and was going to ask her some more specific questions about exactly what she would be needing. And it was clear that there had been a miscommunication because she informed me that she was no longer in need of my services, and good luck with my project. So this was a very discouraging roadblock. It was March, so at this point I didn't have time to research other places and find a new recipient. So I kind of had to take a step back and think about what this meant about the problem I was trying to solve and what did this imply. And basically the conclusion I came to was that me as a high school student trying to solve this huge problem is too big of an undertaking to do alone. And I don't have enough power or resources or even knowledge about this to do it by myself. So I decided to contact government officials and seek help on a higher level. So I contacted about 3, and I wasn't expecting to, but I did receive a response from the Massachusetts Secretary of Health and Human Services, Kate Walsh, and she was able to provide me with some information about how this process played out in Massachusetts that I previously didn't have access to. And she essentially confirmed that this was a concern in Massachusetts as well, and that they also had to make specific efforts for the non-native English speakers in Massachusetts. I also applied to attend Senator Rauch's Youth Summit, which is an event where high school students can go and propose ideas about how to solve issues that are meaningful to them. And I was able to propose my idea in front of the senator and receive feedback from her and also from other students who were there. I also learned a lot from other students about topics that I'd never even thought about before. So this is me at the State House. I'm the second from the right. And I also submitted a piece to the Medway Millis newspaper about my experience at the Youth Summit. So that's another way to get some information out about this issue. So some successes. I was able to receive several positive responses from colleges and have some really good conversations with foreign language professors. And I was also able to learn about a meaningful topic. If I had never done this internship, I probably never even would have thought about this. And I found something that I'm passionate about. And I was also able to learn about a lot of things at the Youth Summit that I never knew about either. I was able to speak out about this issue through many channels and get some awareness out. And I was also able to overcome a lot of challenges. Because this project meant so much to me, it was very difficult to move on after roadblocks, but I think I was able to reach a conclusion that I'm proud of myself about. Areas for improvement. I need to work on following up with contacts and being more persistent, because I think there are probably a lot of people who are in need of these services that we just don't know about. And if I had followed up more, maybe I could have found those people. Also being a clear and effective communicator and presenting my expectations from the beginning, and also setting realistic goals for myself, because I think it's important to know how big of an undertaking this was from the beginning. So how my project connects to the vision of a graduate. So in terms of collaboration, I collaborated with other students at the Youth Summit, provided feedback, received feedback. I also was the collaborator between universities and organizations, though it didn't actually finish out the way I planned. My whole project was essentially communication. I sent emails to government officials and colleges. I communicated regularly with my mentor, and throughout the summer, I was the sole contact of many Medicaid members. I used critical thinking in order to come up with my project as a whole, and problem solving throughout my project through roadblocks and like solving conflicts. And through my character, it demonstrates my empathy for the Medicaid community and also my ability to respect rejection and use it as a way to move forward and learn from the rejection. So for some final thoughts, though I wasn't able to complete my original goal, I still learned a lot of really valuable lessons about myself and about the world, and I'm thankful for this experience as a whole.